Hi, Michael Bloom, chiropractor. Thanks for watching. I want to share with you today some research information I think is pretty interesting and potentially useful to you, depending on if you are someone who suffers from lower back pain in particular. You may find this interesting. The study was titled Manipulation or Microdiscectomy for Sciatica, a prospective randomised clinical study. So putting that into plain English, manipulation meaning hands-on therapy versus microdiscectomy, which is surgery for sciatica, and sciatica is leg pain, which actually stems from problems that come to do with the nerve roots, so the branches off the spinal cord that come out through the small gaps between the actual bones of the spine and the lower back. In this study, which was 120 patients, in order to qualify for the study, the patients needed to have had 3 months of management prior to entering the study, which was deemed unsuccessful. And that management would include analgesics, lifestyle modification, physiotherapy, massage therapy, and or acupuncture. So these people were randomly chosen and put into either a microdiscectomy or a standardized chiropractic spinal manipulation group. And really what it shows is that both groups improved significantly. It didn't really matter. They improved whether they had the microdiscectomy or they improved whether they had the manipulation. And here's where my take is, I think is important, and that is that if you are considering getting an outcome, and the outcome can be achieved through the minimal amount of invasion to the human body, then in my opinion that it's worth pursuing that form of intervention to get the outcome you're looking for. Interestingly, there were a few people that went from the spinal manipulation group into the discectomy group down the track because the spinal manipulation hadn't helped them to the level that they hoped, and they had the similar outcome to the people that had initially had the microdiscectomy. So they still got the benefit from the surgery ultimately, but they gave it a go with the hands-on, more conservative treatment first. Conclusion: that 60% of people with sciatica who'd failed at the other forms of management benefited from spinal manipulation to the same degree as if they underwent surgical intervention. And of the 40% left unsatisfied, subsequent surgical intervention confers excellent outcome. So it's an interesting study. It's not saying that surgery is bad, it's not saying spinal manipulation is great, it's saying that they both can be useful, and that also that if you delayed having spinal surgery because you were trying hands-on care first, you still could have a good chance of getting the same outcome as if you had the spinal surgery in the first place. And hence, just reiterating a point I made a moment ago, I believe it's always useful to try and approach a problem or a challenge within the human body with as natural a means of dealing with it as possible. And in that case, hands-on care is clearly less invasive than entering a hospital and have surgical care. So I hope you got something out of this reflection on this research study. If you are dealing with lower back pain, leg pain that you believe mightn't be a leg problem but from the lower back, well, based on this study, I think it might be worthwhile seeing someone who offers conservative care, hands-on care, and getting a thorough assessment done with that person to see if they may be able to help you. Hope you've enjoyed watching it. I hope you're having a great day, and stay healthy and stay smiling. Cheers.